You know that feeling, that burning sensation after a really good meal? Most of us just chalk it up to heartburn. But what if it's actually something more? Today, we're going to talk about GERD. It's a condition that's way more than just a little discomfort. We're going to get into what's really going on inside your body and what the science tells us about how to handle it.
Yeah, I think we've all been there, right? You finish dinner, you're feeling good, and then boom, that burning feeling starts creeping up your chest. That's heartburn, and it's the classic sign of GERD. But here's the million-dollar question. When does that occasional annoyance turn into something you really need to pay attention to?
So that's really the heart of the matter. A little bit of reflux now and then, totally normal. Our bodies are actually built to deal with it. The real problem starts, and this is when we start calling it a disease, when that reflux just doesn't stop. It becomes chronic, persistent, and it really starts to cause some serious issues. Okay, so here's the official definition, basically. We call it GERD, which stands for gastroesophageal reflux disease, when that backflow of stomach contents happens so often that it's causing you real, troublesome symptoms. It's that line in the sand between something that's just a minor annoyance once in a while and a chronic problem that's messing with your day-to-day life. And believe it or not, GERD isn't all the same. It actually comes in two main flavors. About 60% of people have what's called non-erosive GERD, or NERD. Yeah, I know, great acronym. This means you've got all the awful symptoms, but when doctors take a look, there's no visible damage to your esophagus. The other 40%, though, have erosive GERD, and that's where the acid has been doing its dirty work long enough to cause actual visible irritation and damage. So the big question is, why does this even happen? To really get it, we need to kind of pop the hood and look at the mechanics of our own bodies. It almost always comes down to one of three main things going wrong with our natural defenses. All right, first up, picture a little one-way gate at the bottom of your esophagus. That's your lower esophageal sphincter, or LES for short. Its whole job is to swing open to let food down into your stomach and then slam shut to keep everything in there. Well, with GERD, that gate gets a little lazy. It gets faulty. It relaxes and opens up when it's not supposed to, and that's what lets all that stomach acid and food come rushing back up. The second problem is all about pressure. Think of your stomach like a balloon. If you build up too much pressure inside it, which can happen for a bunch of reasons like obesity or pregnancy, that pressure can literally just overpower that little gate we talked about. It just forces everything upwards, right back into the esophagus. And the third major issue, well, you can think of it like a really slow cleanup crew. See, your body has these clever little ways to wash away any acid that manages to escape, using things like saliva and the muscles in your esophagus. But if that whole cleanup process is sluggish, that acid just sits there, lingering, causing irritation and damage for way too long. So, what are the things that put you at a higher risk for this? Well, it's a mix, really. Some are medical conditions, like obesity or something called a hiatal hernia, but a lot of them are lifestyle factors. Things like smoking, drinking alcohol, even that morning cup of coffee can be major triggers. And simple habits, like lying down right after you eat, that can make things a whole lot worse. Okay, so we've covered what GERD is and why it happens. Now let's talk about the symptoms, how you actually feel it. And trust me, it's not always as simple as just a little heartburn. We all know about the classic signs, right? Heartburn, maybe some regurgitation, but GERD can be really sneaky. It can pop up in ways you'd never expect. We're talking about a chronic cough that just won't go away, especially at night. Or maybe your voice is always hoarse. It can even make asthma worse or cause dental problems as acid erodes your teeth. And get this, it can cause chest pain that's so intense, people sometimes think they're having a heart attack. Okay, I really want you to listen up for this next part because this is super important. GERD is common, for sure, but there are certain symptoms that you should absolutely never, ever ignore. We call these the red flags, and they mean it's time to see a doctor right away. So what is that line? When does this go from being just uncomfortable to being a real warning sign that something more serious might be happening? All right, here are the big ones. If you have trouble swallowing, like food feels stuck, that's called dysphagia. Or if it's actually painful to swallow, that's odynophagia. Other huge red flags are any signs of GI bleeding, which might show up as anemia, losing weight without trying to, or vomiting over and over again. And here's why these are such serious red flags. It's because they can be a clue that the problem is more than just simple reflux. These symptoms demand a closer look from a doctor, usually with a procedure like an endoscopy, to make sure there isn't something more serious going on, like significant bleeding or even, in some rare cases, cancer.
So let's say you've been diagnosed with GERD, but thankfully you don't have any of those red flag symptoms. What happens next? The good news is there is a really clear, step-by-step game plan for treatment.
Typically, the first step is what's called an 8-week trial of a medication known as a PPI, or proton pump inhibitor. It's a really logical process. If you take it for 8 weeks and your symptoms completely disappear and you have no complications, great, you might be able to stop. If you feel better but you do have some known complications, you'll probably stay on a lower maintenance dose. Now, what if you only feel kinda better? Then the doctor might increase the dose or try a different PPI. And if you get no relief at all, well, that's when it's time to get a referral to a specialist to dig a little deeper.
And that really brings us to the big takeaway here. It's so easy to just brush off heartburn as, a normal thing that happens. But as we've just walked through, it can be a signal of a much more complex condition. So I'll leave you with this question to think about. Is that discomfort you're feeling just discomfort, or could it be your body trying to send you a really important message?